Philips has been a great telehealth partner. They are very responsive to customer service and have been a great partner to grow with over the last 10 or 11 years. My name is Gretchen Roberts. I am the Senior Director of Patient Logistics and Telehealth for the Ohio Health System. Our telehealth program started about 10 or 11 years ago with the eICU program and has expanded to many areas across the system, including our stroke network, our e-labor and delivery program, and we'll continue to expand as we move into new space and really continue to grow our program. Our eICU program, we monitor roughly 196 beds across our health system in various intensive care units. We also have many mobile carts in our fleet that help us monitor patients in our emergency centers, as well as rapid response teams across our hospitals. When we opened our eICU system, we had several goals in mind. One of those was to establish intensive care coverage with an intensivist at all of our Ohio Health hospitals that had intensive care units. The second was to really augment an already quality program at our health system and make it better in terms of length of stay and mortality of those patients in the intensive care units, as well as offer some nighttime coverage for our hospitals. Many did not have physicians, and today we don't have intensive care physicians, boots on the ground. So our eICU really operates as that air traffic control center during the nighttime hours across our system, responding to the crisis pieces that are happening with those patients in the unit, as well as giving proactive care and continuing the plan of care for many of the other patients in those units. Without eICU, we would have gaps. We would have hospitals that have no intensive care physicians at all, as well as in our tertiary care, quaternary care hospitals, we would have gaps at night with intensive care coverage. We would have intensive care physicians answering phone calls, potentially having to come into the hospital more often, but we have seen great success having the eICU at night, having a physician that's awake and alert and able to really see, both with the camera and the vital sign information and the EMR information, being able to see exactly what's going on with that patient and react to those instances where they need to write orders and notes and take care of those patients. We actually see length of stay reductions and mortality reductions every quarter that we get data back from Philips. Very early on, though, we did a pre and post study of some cohorts of patients in our 3 busiest intensive care units. And immediately, this is 10 or 11 years ago, we saw a 12.5% reduction in mortality in that group of patients. We continue to see the benefits, 10 years and counting, of a reduction of length of stay, a reduction of mortality. Our standardized mortality ratios are consistently under 1.